This is DEFISILPODCAST. So today we're going to be the health topic as it pertains to our health and our well. This means to an extent the food that you eat can also be classified or can also be defined as it therefore means that you took this drug without anybody prescribing it for you. Maybe you had one little symptom or the other, then the next thing you uh, run to the pharmacy and you tell them to give me this, give me that, give me ibuprofen, give me amoxicillin, and all that every drug effect. No drug, I repeat, no drug that does not have what a side effect. So it is based on this now, you now understand what it means when we're talking about drugs and side effects and why you should be very careful with taking drugs unprescribed. Now, even the ones that are prescribed for you, many labels, many informations that are on it, and the information that are written on it, maybe examples of the side effects or the reaction that such drugs might likely cause. And if you take those drugs and they start giving, or you see that it's altering your functioning, the best thing you can do is to go back to your doctor and inform him about this and drug for you. You understand? So every drug has a side effect. Every, not even one that is left out, has a side effect. So have side effects. You understand? So taking it unprescribed will be one of the biggest risks that you can actually do to yourself or even to your health rather. Taking unprescribed drugs or taking unprescribed medication or taking or receiving drugs from quacks. That means people who are not trained, who are not licensed, who do not have the proper knowledge to give you or administer drugs to you. You understand? And let me tell you this. There seems to be a rise or there seems to be a surge in people or individuals with organ failure at the moment, especially kidney, liver issues. Do you know or in some cases even heart issues? Do you know what's causing it? Majority of people are consuming both drugs and substances that's one of the major causes of those surge in organ malfunctionality. Tools he has that, and stuff like that. Do you know what's causing it? They are taking drugs that are prescribed. They are consuming substances. So that's what you must actually know about it. So let's look at some things that can actually the long run negatively when you consume substances or you take drugs unprescribed or the rest of them. Now, smoking and taking of any liquid substance apart from what causing liver and kidney diseases for you are most likely not going to know. Do you know why? The liver is such a way that it is designed that it heals itself. That means if you have an injury or if there is a harm to it, if a substance that you consume has actually harmed it, the liver has the ability to regenerate. That means it has the ability to be functioning as if everything is okay. You understand? So this is the reason why you may not actually know on time that anything is actually wrong. Then if we now go over to the liver, if it's failing at 90% or it's experiencing 90% failure, you are still going to so you discover that is the reason why you hear when people are faced with kidney issues and the rest of them, discover that it becomes very critical. It means that it has passed 90%. So that means when your kidney is experiencing 10% failure, you may not know. There will be no signs. When it's experiencing 20%, you won't feel any sign. 60%, 70, 80, 90, you won't feel any sign. You understand? So this is the reason why we continue to preach, we continue to advocate that people should take their health serious, be very deliberate about the food and substance that you consume into your body. You understand? Now let me tell you this strange thing. Now you see the cream that you rub on your body, it has a way of altering your organ. Do you know why? Because when you rub it, this thing is a liquid. Your body absorbs it. When your body absorbs it, what happens? It gradually goes into your what? Your blood, and from your blood, anything that goes into your blood must surely get to your kidney, must surely get to your liver, and it must surely get to your health. Now, if this cream that you're using to rub yourself contains harmful chemicals that were used during its production, it therefore means that this harmful chemical will find its way into all of these organs on the long run. And the more you keep using those cream, the more the quantity of those heavy and dangerous chemicals will be introduced to these organs, and the more negative effect all of this will cause to your health. You understand? Then if we go further, for smoking has every chances and every possibility, but both first-hand smoking and second-hand smoking has every possibility to cause you long issues or long challenges. That means you know that anything about your respiratory system, smoking has every possibility to cause you respiratory issues. You understand? And let me tell you, do you know that second-hand smoking is even more dangerous majority of the case than first-hand smoking? That means if you are smoking is close to you and you are inhaling the smell, or you are inhaling the toxins that are actually coming from the smoke, it will. Do you know why? Because to an extent, that person's body is has actually built a kind of level of mini resistance against that thing that he or she is smoking. But your body has not seen this kind of this thing, so it absorbs it. It sees it as something very strange to it. So the way your body will react to it will be very negative. You understand? So it's the reason why we say, when you know that you are not a smoker and you have a smoker as a friend, when they are smoking, excuse yourself and leave that environment first. Let them finish whatever they are smoking before you find yourself in that environment. You understand? So don't jeopardize your health. Then if we continue and we go to example of drugs that actually would cause issues to your system or your organs on the long run, is we have the NSAID, that is non-steroidal anti-inflammatory drugs that actually helps you to subside pain and they reduce inflammation. When a place is swollen, these are the drugs that you take, and it reduces the inflammation within a very short period of time. However, when you continue taking them for a very long period of time, they have build-up deposits that actually that goes and heaps on your kidney and your liver, and they gradually damage it without you not should work. Very that enters through your mouth. Gaseous. Agency. You understand? And that's for NSAID. That's saying, or let it just keeping themselves being on ecstasy. They are doing this in ignorance, but when things people consume, our young people in our time now consume, they have a majority of these interact negatively with food alcohol, and other medication, causing severe reaction. And when all of these reactions are in the, let me say in my area, not just in my area, let me say in my city and its environ at large, or far environ, and even in my city, when you see a young boy or a young lady with a can of Chivita Active or Chi Exotic or a pack of Ribena, do not be tempted to go and beg him or her that you want to sip a little from it, or you see him, what is there is not Coca-Cola, what he or she is holding is not what? It's not Ribena, what he or she is holding is not Chivita Active, it is not what? Chi Exotic. What majority of them are holding is Ribena plus Tramadol plus Refnol plus, all kind of drugs mixed together, and we know inside of that particular container that they actually holding at that particular time. So do not be tempted to what? To take anything as liquid from those people. You understand? You go just own one and you go call security. No, you go just own one. Ekwakwa huleleti. So, in a nutshell, comes with harmful side effects, allergic reaction, organ damage, such as damage to your kidney, your liver, and your brain over time. Then number two, mental and emotional effects. There is every tendency that when you take drugs unprescribed, on the long run, you're going to face the risk of what? Of addiction. You understand? Mood swings and anxiety is going to what? Which will lead to your what? Depression. And unnecessary aggression will be what? Will be there. The memory loss and confusion there's every risk of you having memory loss and confusion, and this could be can lead you to a psychiatric patient, because neurological drug can cause cognitive impairment if consumed or if used without prescription. Then drug interactions. Drugs are not meant to be taken together. So by the time you happen to take these drugs together, or they now interact with your food, your medication, this can cause severe negative reaction that will have an effect based on the fact that some drugs are not meant to be taken together. When you take them together, there will be less effectiveness. You understand? So you will be taking them, and it will seem as, based on the fact you are not supposed to, be in possession of those drugs, it can doping or anti-narcotics, depending on whichever agency that is enforcing the drug, this dosage, and even death. You understand? High doses of mixing medication incorrectly can lead to coma, can lead to seizure. By a doctor who understands your medical history. Misuse of drug is very dangerous. It's unpredictable. You understand? As I am, let me use myself as a case study. During my days as a student, various types, you understand? Whenever I discover this person is having a particular issue, even this is even as a fee as an exercise to carry how your medication have been over time, drugs that are usually prescribed to treat those medication, diseases that you usually experience. What are the diseases you do not experience? You understand? So it is what you should take. You understand? So do yourself more good than harm by taking drugs as only prescribed by a medical doctor, and uh, that will benefit you on the long run rather than doing you harm on the long run. This is Deficit Podcast, and I will talk to you in the next one. If you have any question, do well to drop in the comment section. And it is my desire for you that you live with any health challenges. So it's the reason why we're bringing this sensitization to you, that you should live a life that Thank you, and I'll talk to you in the next one. Do well to follow us across YouTube, Facebook, Instagram, X, Rumble.